What we know is that people who are sick spread illness. We also know that even with more asymptomatic transmission happening than we previously thought, all of the recommendations we have made about keeping 2 meters distant from others, having close contacts of cases, or returning travelers stay home for 2 weeks from their last exposure, those recommendations are more important than ever. In addition to, not in place of, following all of that advice, there may be added benefit for those who are well and in places where they cannot keep 2 meters distant from others to wear a face covering. Wearing a non-medical mask, such as a homemade cloth mask, has not been proven to protect the person who is wearing it. However, it may be helpful in protecting others around you. This is because face coverings are another way to cover your mouth and nose to prevent respiratory droplets from contaminating other people or surfaces. Additionally, wearing a mask may stop you from touching your nose or mouth. If you choose to wear a non-medical mask or face covering, it should be well fitted and not gape at the sides. You should also be aware that masks can become contaminated on the outside. Avoid moving or adjusting the mask. After wearing the mask, assume that it has been contaminated and take the proper precautions. Critically, if you wear a mask, you must wash your hands before putting it on, as well as before and after taking it off. Cloth masks should be worn only a short time, as there is some evidence that they can trap virus particles after they become damp, which may put the wearer at greater risk of being infected. For those choosing to wear non-medical masks, it may be prudent to carry a bag with several clean masks in it, as well as a plastic bag that can be used to safely store used masks until they can be washed at home. It is critical that used masks be carefully handled to avoid spreading infection to others. For the average Albertan, if in their day-to-day course of their activities, they are always 2 meters apart from everyone else, that wearing a mask would not provide any added benefit. And because there are some potential, again, possible harms of mask use, that this would be something that only those really who are going to be in situations where they can't avoid coming into closer contact with people, that it would be more valuable in those situations. And again, the use of a face covering in those general public interactions is really about protecting everyone else from the person who's wearing the mask, because it's really about making sure that any respiratory droplets that might be produced when someone is speaking, when they're out and about, that those droplets are contained. So again, really focused on those situations where people can't avoid closer contact with others. I want to be clear that in healthcare settings or occupational settings where there is that risk of encounter with someone who's ill, that's a different category, and that's always been the recommendation with respect to wearing masks in those encounters. And in those encounters, it is a mask combined with other personal protective equipment and other engineering controls to prevent that spread of infection. So they're two different situations. With respect to how quickly this recommendation was made, one of the things that's important to me as we plan our response and as I make my recommendations is to make those based on the best available evidence. Certainly there are countries that had moved ahead with cloth mask recommendations earlier. We know, again, from our review of the literature that does exist, that cloth face coverings, again, can have some risk. And so I think that it's important to make sure when we are making a recommendation or providing advice, that it's based on a review of the best evidence possible and that we don't move so quickly towards something that we potentially put people at risk. And so that, again, was important to me, that we review all evidence available. So I think there will be many lessons learned at the other end of this response, and I'm sure there will be opportunities to understand the timing of when we did things. But what we have always done in Alberta is made the best decisions we can with the evidence that we have at the moment and continually assess that evidence and the need for making any further changes, and we will continue to do that. The most important steps you can take to prevent the spread of infection remain the same. Consistent adherence to good hygiene, such as proper hand washing, following all public health orders, staying home whenever possible, particularly if you are feeling ill, and practicing physical distancing when you need to go out are the best ways to keep yourself and those around you healthy. These practices will become even more critical in the following weeks. As we see fewer travel-related cases, this is the time when community cases may start to rise. We must do everything we can to prevent the spread of this virus from person to person in the community. I know this is becoming increasingly difficult the longer this goes on, and especially with a long weekend coming up when normally people would be gathering together. But please continue to stay home. The less you are out in the community, the less chance you have of contracting or spreading the illness.